Anxiety disorders represent a prevalent category of mental health conditions, characterized by excessive and persistent worry, fear, and apprehension. These distressing emotions can significantly impair an individual's daily functioning, relationships, and overall well-being. While it is normal to experience anxiety in certain situations, such as before an important event or during times of stress, anxiety disorders involve an overwhelming and debilitating level of anxiety that disrupts normal life. Anxiety disorders encompass a range of specific conditions, each with its unique set of symptoms and diagnostic criteria. However, they all share the common thread of excessive and persistent anxiety that is out of proportion to the actual threat or situation. This essay delves into the realm of anxiety disorders, exploring their various manifestations, underlying causes, and effective treatment approaches. Anxiety disorders are often accompanied by physical symptoms, such as a racing heart, shortness of breath, sweating, trembling, and gastrointestinal distress. These physical sensations can further exacerbate anxiety and contribute to a vicious cycle of fear and discomfort. Understanding the interplay between the psychological and physiological components of anxiety is crucial for effective diagnosis and treatment. It is important to note that anxiety disorders are highly treatable, and with the right support and interventions, individuals can experience significant symptom reduction and improved quality of life. By raising awareness about anxiety disorders, we can help to reduce stigma and encourage individuals to seek professional help when needed. Anxiety disorders manifest in various forms, each with its own distinct set of symptoms and patterns. This section provides an overview of some of the most common types of anxiety disorders. Generalized anxiety disorder, GAD, characterized by excessive and persistent worry about a wide range of everyday events and activities. Individuals with GAD often anticipate the worst and find it difficult to control their anxious thoughts. Panic disorder, marked by recurrent and unexpected panic attacks, which are sudden episodes of intense fear, accompanied by physical symptoms such as a racing heart, sweating, trembling, and dizziness. People with panic disorder may develop a fear of having future panic attacks, leading to avoidance behaviors and significant impairment in their lives. Social anxiety disorder, SAD, involves intense fear and anxiety in social situations, often stemming from a fear of being judged, humiliated, or embarrassed. Individuals with SAD may avoid social gatherings, public speaking, or interactions with others, leading to social isolation and difficulty in personal and professional relationships. Phobias, characterized by intense and irrational fears of specific objects or situations, such as spiders, heights, or flying. People with phobias typically go to great lengths to avoid their feared objects or situations, which can significantly disrupt their lives. Understanding the different types of anxiety disorders is essential for accurate diagnosis and effective treatment. Each disorder may require a tailored approach based on its specific symptoms and underlying mechanisms. Generalized anxiety disorder, GAD, is characterized by chronic and excessive worry that is difficult to control. Individuals with GAD experience persistent anxiety about a variety of everyday events and activities, such as work, finances, health, family, or minor matters. The hallmark of GAD is excessive and uncontrollable worry that persists for at least 6 months and is accompanied by at least 3 of the following symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. The anxiety and worry are out of proportion to the actual likelihood or impact of the feared events. Individuals with GAD often anticipate the worst-case scenario and find it difficult to relax or enjoy themselves. They may engage in excessive planning, reassurance-seeking, or procrastination as a way to manage their anxiety. The chronic worry and associated symptoms can significantly impair their quality of life, affecting their work, relationships, and overall well-being. Diagnosing GAD involves a thorough evaluation of the individual's symptoms, medical history, and psychosocial stressors. Treatment typically involves a combination of psychotherapy, such as cognitive behavioral therapy, CBT, and medications, such as antidepressants or anti-anxiety medications. Panic disorder is an anxiety disorder characterized by recurrent unexpected panic attacks. Panic attacks are sudden episodes of intense fear that peak within minutes, during which time 4 or more of the following symptoms occur: palpitations, pounding heart, or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, feelings of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills or heat sensations, paresthesias, which are numbness or tingling sensations, derealization, which are feelings of unreality or depersonalization, being detached from oneself, fear of losing control or going crazy, fear of dying. The unexpected and intense nature of panic attacks can be terrifying, leading individuals to fear future attacks and avoid situations where they might occur. This fear of having panic attacks, known as anticipatory anxiety, can significantly restrict an individual's activities and lead to agoraphobia, a fear of open or public spaces where escape might be difficult. Social anxiety disorder, also known as social phobia, is characterized by intense fear or anxiety in social situations where individuals feel exposed to possible scrutiny by others. These situations may include meeting new people, public speaking, performing in front of others, eating or drinking in public, using public restrooms, making phone calls, and attending social gatherings. Individuals with social anxiety disorder fear that they will act in a way or show anxiety symptoms that will be negatively evaluated. This means they worry it will be humiliating or embarrassing, will lead to rejection, or offend others. The social situations almost always provoke fear or anxiety. The fear or anxiety is out of proportion to the actual threat posed by the social situation and to the sociocultural context. The fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. Social anxiety disorder can significantly impair an individual's personal, social, and occupational functioning. They may avoid social events, limit their career choices, or experience difficulties forming and maintaining relationships. A phobia is an anxiety disorder characterized by a marked and persistent fear or anxiety about a specific object or situation, such as flying, heights, animals, receiving an injection, or seeing blood. The phobic object or situation almost always provokes immediate fear or anxiety and is actively avoided or endured with intense fear or anxiety. The fear or anxiety is out of proportion to the actual danger posed by the specific object or situation and to the socio-cultural context. Phobias are often categorized into specific types, including animal phobias, fear of specific animals such as spiders, snakes, dogs, or insects. Natural environment phobias, fear of natural events or environments such as heights, storms, water, or darkness. Blood injection injury phobia, fear of blood, injections, medical procedures, or injury. Situational phobias, fear of specific situations such as flying, enclosed spaces, driving, or bridges. Individuals with phobias go to great lengths to avoid their feared objects or situations, which can significantly disrupt their daily lives. For example, someone with a fear of flying may avoid air travel altogether, limiting their career or personal opportunities. The development of anxiety disorders is complex and multifaceted, involving a combination of genetic, biological, environmental, and psychological factors. While the exact causes of anxiety disorders are not fully understood, research suggests that the following factors may play a role. Genetics. Anxiety disorders tend to run in families, suggesting a genetic predisposition. Brain chemistry. Imbalances in neurotransmitters such as serotonin, norepinephrine, and gamma-aminobutyric acid, GABA, have been implicated in anxiety disorders. Environmental factors. Traumatic experiences such as abuse, neglect, or witnessing violence can increase the risk of developing anxiety disorders. Stressful life events. Major life changes such as job loss, divorce, or the death of a loved one can trigger anxiety disorders in vulnerable individuals. Personality traits. People with certain personality traits, such as perfectionism, low self-esteem, and a tendency to worry, may be more prone to anxiety disorders. Medical conditions. Certain medical conditions, such as hyperthyroidism, heart disease, and respiratory illnesses, can cause or worsen anxiety symptoms. Understanding the underlying causes and risk factors of anxiety disorders can help healthcare professionals develop personalized treatment plans and provide appropriate support to individuals struggling with these conditions. Fortunately, anxiety disorders are highly treatable, and various evidence-based treatments can help individuals manage their symptoms and improve their quality of life. The most effective treatment approaches typically involve a combination of therapy, medication, and lifestyle changes. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. CBT teaches individuals to challenge and reframe negative thoughts, develop coping mechanisms for anxiety-provoking situations, and gradually confront their fears in a safe and controlled environment. Several types of medications can be effective in treating anxiety disorders, including antidepressants, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed to regulate mood and reduce anxiety symptoms. Benzodiazepines. These medications work by enhancing the effects of GABA, a neurotransmitter that has calming effects on the brain. However, benzodiazepines are typically used for short-term relief due to their potential for dependence and side effects. Other medications, beta blockers, anticonvulsants, and atypical antipsychotics may also be used in some cases to manage anxiety symptoms. Making certain lifestyle changes can also play a significant role in managing anxiety. Stress management. Engaging in stress-reducing activities, such as exercise, yoga, meditation, or deep breathing techniques, can help regulate the body's stress response. Sleep hygiene. Establishing a regular sleep schedule, creating a relaxing bedtime routine, and avoiding caffeine and alcohol before bed can improve sleep quality, which is essential for managing anxiety. Regular exercise. Physical activity releases endorphins, which have mood-boosting effects and can reduce anxiety symptoms. Healthy diet. Eating a balanced diet, rich in fruits, vegetables, and whole grains, can provide the body with the nutrients it needs to function optimally and manage stress. Avoiding caffeine and alcohol. These substances can worsen anxiety symptoms and interfere with sleep. It is essential to work closely with a qualified healthcare professional to determine the most appropriate treatment plan based on the individual's specific needs and preferences. Anxiety disorders are common mental health conditions that can significantly impact an individual's life. However, it's important to remember that these disorders are highly treatable and effective interventions are available. By understanding the symptoms, causes, and treatment options for anxiety disorders, healthcare professionals can provide comprehensive and compassionate care to individuals struggling with these conditions. Through a combination of evidence-based therapies such as CBT, appropriate medication management, and healthy lifestyle modifications, individuals can experience significant symptom reduction and improved quality of life. Early identification and intervention are crucial in promoting the best possible outcomes for individuals with anxiety disorders, empowering them to live fulfilling and meaningful lives.